Hello, everybody. I'm recording this a little later than I originally wanted to, but some people have encouraged me to finally make a video about it. Recently, I and many other people have been talking online, and I guess to people who we know, about this what they're calling this opioid crisis, and the fact that there are problems, but what's being done is it's being pushed all over the media as this giant out of control crisis that affects everybody, and they're also pushing for opiates to be eliminated or extremely controlled and reduced and taken as much as possible out of the picture, out of distribution and everything. And there are plenty of articles online where I'm not going to go into this and start going into detail, but I guess if I can, I will post some links in the description. But there are plenty of articles that describe what's wrong with that approach. The first and foremost being that they are persecuting doctors and harassing doctors, and examining every little thing that they do, every prescription they write, everything in such a way that is instilling a lot of fear with the doctors who are just trying to conduct healthcare, treat their patients, and the patients who suffer from chronic pain and need the medication are really the ones who are suffering the immediate. The flaw in the system is that we are the ones who need medication, who are prescribed by a doctor. We're not buying it on the street. We are taking it as prescribed, and a lot of us different dosages, whatever is needed in order to have something of a quality of life, and to work with the doctor to keep the pain controlled to a level where it's manageable and where we can live with it. And given how they're going after doctors and scaring them, we're the ones who are suffering. We're the ones who genuinely need this. We're the ones who this medication exists for. People who suffer from pain. The junkies and the people who are abusing it are not being affected by this very much. And if they are, they're the second in the chain, because the doctors are starting to get too afraid to even deal with this. And I'll get to the details of what happened, but my pain management doctor, who I was with for a couple of years already, has recently stopped prescribing any opiates as a matter of practice. They've completely changed their practice, and I confirmed with them off the record that it's because of what's going on with the DEA. They know how to prescribe, they know how to treat pain, and they know that they're not doing anything wrong, but they're just afraid because everything is being scrutinized so finely. They are genuinely afraid that even if they do everything by the rules, something is just going to be looked at by some non-doctor in this council at the DEA and just decide that they don't like something about their practice. They're afraid to lose their license, they're afraid to lose their profession, and they're afraid of insurance and lawsuits, and all just for doing their jobs. So they have eliminated any opiate prescribing from their practice, and many other doctors as well. I actually encountered several in the recent month who, up until very recently, prescribed opiates as part of their practice, in addition to all the other treatments that may be attempted, to sufferers from chronic pain. And it's just one of many treatments, only they have recently stopped because they are just too scared. Doing their job could get them in a lot of trouble, just conducting healthcare. And so it's being interfered with. And people like myself are the ones who are suffering. So that's a problem. Now, on top of that, many people have You can also find this online. There are many people written articles, or many people have posted in forums where chronic pain sufferers discuss their circumstances. That the approach a DEA is taking is the first and foremost thing it's going to do is going to cause people who genuinely need the medication to be denied the medication and have no choice but to find it elsewhere, because the alternative is live in pain, live in your bed, and be bedridden, homebound, and have no quality of life and be in pain all the time. And some people, unfortunately, will seem to think that that's the best that they can ever have and choose to no longer be alive. Many of us have predicted and said outright, you're going to cause sufferers of chronic pain to have to get their medication elsewhere, and then they're going to not be able to get it from doctors anymore. And lo and behold, I can give you a perfect example because I experienced this recently. Since, as I mentioned, my previous doctor has stopped treating with opiates, I don't have to go into this in detail. Suffice it to say that I have tried all other possible treatments for my condition, and I'm continuing to explore other treatments, but nothing else has had any positive effect, and so I have had to be on opiates. It's not like a crazy dosage. It's I'd say moderate to heavy dosage, but has given me a quality of life where I can live with the pain and I can cope with it, and sometimes I have better days, and sometimes not so good, but at least I have a life. So nothing that doctor was able to provide was any benefit. I mean, I've had a dozen injections, and they have not done anything. It's due to the nature of why I have chronic pain, where the damage is. So I had to start looking for a new doctor, and there are so many who don't treat with opiates. And even trying to find this out is a problem, because if you call a doctor knowing, I mean, if you're simply an educated person, a person who has taken an active role in their own health care and not just gone to doctors and just do what they say, but also done research and learned enough to understand what's wrong with you, why what's wrong with you is what it is, the nature of the problem, the nature of treatments that are available. If you're smart enough and informed enough to know that, unfortunately, opiates are what you need right now, and you call a doctor and you want to inquire as to whether they treat with opiates, you are immediately flagged as a junkie. Like, immediately. They don't even have to know you. They don't have to meet you. They don't have to know anything about you. So you kind of have to call anonymously to find this out. And sometimes you'll be lied to. They'll say no when in fact they do. They just don't want to say it to you over the phone because they think, well, then you're going to show up and you're just a junkie in their office. It's sick and it's sadistic. And people who are suffering are made to suffer more and are mistreated and are vilified and are criminalized, all because of actual criminals and actual abusers. So it took me a very long time. And during that time, my previous doctor, who in a behavior that I think is extremely questionable when it comes to medical ethics, cut me off just abruptly and was no longer willing to give me any medication. They did not taper me off of the medication. They did not give me a supply for as long as it takes for me to get a new doctor. They gave me one last month and they cut me off. And what happens is you go into withdrawal. You start to have detox symptoms. And I stretched it as long as I could while looking for a new doctor. I even had an appointment, made an appointment with somebody whose assistants told me on the phone they do prescribe when necessary. Went in several weeks later when my appointment time finally arrived. And it turns out he said, I don't anymore. And he was unwilling to prescribe for me. At that point, I was looking all the time. I was constantly calling doctors, looking through my health insurance, their doctor roster, and looking for anybody who is a pain specialist, and finding out whether they prescribe opiates if necessary. And so it got to the point where I didn't have anything left. And I told my previous pain doctor, I'm going to go into withdrawal. and this could hurt me. I've been advised that going into withdrawal could cause seizures. It could cause all kinds of problems. The doctor said, "We're not giving you any more. It's too bad. You should have just weaned yourself off. You should have." They just blame the patient, of course. So the questionable ethics of their actions aside, I did go into withdrawal, and in the middle of the night at 2 o'clock in the morning, had to be taken to the emergency room. The doctor there was very understanding, saw what I was going through. I brought along all my records because I have all my records in a folder because I'm applying to disability. So I always have my records available, and they're all printed out and organized. And if I go to a doctor, I bring them with me so that they can see what my history is with this ailment. And we brought them along, and so they gave me a dose of medication, and they gave me also 2 more doses because it was just happened to be the following day I had an appointment set with another pain doctor who is affiliated with an organization that advocates for pain patients, and so I was advised by them that yes, this guy prescribes. So the hospital gave me enough to get to that, to get to this appointment the following morning. Following morning, I get to that appointment. No, I don't prescribe. Again, the same deal again. I don't prescribe. So then I was back to square one. Fortunately, this is the part that I'm going ahead and saying it because I just don't care. It needs to be said. I got hold of medication. I got hold of medication through somebody, and it's not important how or who, but I got hold of medication that is prescription medication. It's not street medication. It's from pharmacy. It's medication that I know what it is, the dosage and everything. And so I was able to treat myself very sparingly just so that I would not go into withdrawal. So I treated my pain minimally, and so that I wouldn't go into withdrawal. Fortunately, then I subsequently found a doctor who prescribes, and so I made an appointment and then went to the appointment. One of the first things they do is have you take a urine test. So I informed the doctor, you're going to find this other medication there, because I've had no choice but to take that, because I was cut off, over whatever, it's been 2 weeks or so that I was cut off, and I was going into withdrawal. I wound up in the emergency room, and he's like, the first thing he was like, this is terrible, how mistrustful. I said, you have to understand, I went into withdrawal. I'd been looking every day for a new doctor. My previous doctor cut me off from opiates from a 10 milligram every 4 hours. That's 6 in 24 hours, 60 milligrams in 24 hours, consistently for almost 2 years. They abruptly cut me off, and I wound up in the emergency room. And I said to him, I understand the way you see it, how I have this other medication in my system. It looks like I'm cheating, and I'm doubling up. I'm not, but I want to know, what would you have done? He said, I would have gone to the emergency room. I said, yeah, but every night? And he shrugged his shoulders. In other words, he understood my predicament, but I went and he referred to it as street drugs, and I said, no, it's not street drugs. It's prescription medication from a pharmacy that I got hold of, and I took responsibly just so that I could continue living and having my pain at least dealt with a little bit, and not go into withdrawal. And now I'm here, and now I will, if you take over my case and you prescribe for me, I will no longer take the medication that I got hold of. It's because I don't need it. And the doctor was very, very worried, and he said, do you know how this looks? Because if this is in your blood, in your urine, and so we have to record that we found this medication, now we're giving you a prescription, do you know what the DEA will think when they see something like this? And I almost lost it, because the DEA are the one who are causing this scenario to begin with, because they scared my old doctor into taking opiates out of their practice and not ever prescribing. They caused my old doctor to be so scared that they had to cut me off abruptly and make me go into withdrawal and end up in the emergency room. I had no choice, which is exactly what we have been predicting all along. We have been warning everybody and saying the DEA's actions and scaring the doctors and trying to get opiates out of existence is going to cause people like me who suffer from chronic pain to have to get drugs on our own, and that's just what I had to do. And the prescribing doctor who I went to now was so worried that I did that he was hesitant to now take over my case and start prescribing as a regular doctor again. So this is the problem, was predicted, and now I have a case in point where exactly what we predicted would happen has happened. I'm fortunate that this doctor did take on my case because he was very understanding and very nice and compassionate, but he told me that it's a very, very thin ice that he was on, and he prescribed me a reduced dosage. Right now, I'm not handling that well, and I'm going to go ahead and try to speak with the doctor now, because it's been almost a week and I've been on a reduced dosage and I'm not handling it well. I have sacrificed a lot of my functionality, and I've been in a lot more pain and spending a lot more time in bed recuperating from that pain between doses. But this doctor was willing to take on my case and start prescribing. But the very fact that he was very nervous, and if I didn't have all of my documentation showing everything I had tried, showing for years, going to different specialists and everything, and all of my medical history, he may have just decided, you know what, this is just a junkie, and he may have kicked me out. But fortunately, he was very nice and understanding. Now, I'm sure other people won't get that necessarily that benefit of the doubt. And so I wanted to make this video because we in the community of, unfortunately, of people who suffer from chronic pain and have been having a lot of trouble getting this medication to continue to be prescribed as it has for years and years, for some people decades. For me, it's been a few years just, but we predicted that going and persecuting doctors is going to make those doctors scared to treat their patients properly, interfering with health care and interfering with the doctor and patient relationship, where they know what the patient's going through, where the patient trusts the doctor, and the doctor treats the patient so that he can have quality of life. Interfering with that and persecuting the doctor and the pain patient is going to cause patients to have to go elsewhere, because otherwise you're being told by the DEA, you know what, these medications are being abused, so you, who are not necessarily abusing it, we have to assume everybody is, and we have to get it out of the system, we have to deprive you of it, and you have to either go and become a criminal or suffer. You have to suffer. Those are the rules. If you're unlucky enough to have a condition that causes chronic pain, you must suffer, because other people abuse these medications, and we need to put an end to it, and this is the only way we can think of. So we said, you're just going to cause people to have to go and get medication however they can, and then they won't be trusted. And here you go is what happens. And we were right. And it's going to continue to get worse. And what we're predicting is that ultimately opiates are going to be, if not completely eliminated, you're going to be hard pressed to find a doctor anywhere who will prescribe them. Of course, they want to push all these other things that may work for some people, but for some don't. And for the people who don't benefit from something like a spinal cord stimulator or some other medication or injections, well, you're shit out of luck. You have to suffer, be in pain, and not have the benefit of medication that for decades or years has helped you have quality of life. Sorry, tough luck. This is what's going to happen. We predicted everything coming up until now. We've been saying what's going to happen because you don't have to be a genius to recognize what's going to happen. All you have to be is somebody who has a stake in this. Because if you don't, you really don't care. You just want to stop seeing headlines about people overdosing. The fact that, excuse me, as sympathetic as I am, those people chose to take medication against the prescribed amount, more than they were prescribed, they became addicted and didn't get addiction treatment. They chose to abuse the medication. As sympathetic as I am, they made a choice. I didn't. I've taken it as prescribed exactly for all the years I've been on this medication. I've taken urine tests and had no problem up until now. But because all of the doctors are starting to eliminate it, I got to the point where I was thrown into withdrawal. I wasn't even allowed the benefit of tapering off so that I'll be in pain, but I won't go into detox. No. So this is what happens, and it's going to continue to get worse, and I'm sorry to say, you can excuse me, you can keep this video. You can save a copy of this video, because I'm telling you right now, suicides are going to go up. Not people using drugs or criminals or just in general. I'm talking about suicides by people who suffer from chronic pain. You will see them go up. I'm telling you right here. I promise you, you will see them go up, because some people just can't live anymore in chronic pain, in agony, and the only remedies available are being denied. You're being told, no, you got to go and suffer. Too bad. I promise you, you are going to see that go up. I hate that it's going to be what happens, but it will happen, because they will not listen. They won't back off with this approach. They will not just allow healthcare to work. They want to stop opiates from getting prescribed so that they can say that they put an end to the opiate crisis. Because if they're not anywhere, then of course it's not going to entirely stop it, because people can get hold of it. But a lot less people will get hold of it. And people who suffer from chronic pain are going to see nothing in their future, but nothing but suffering. I promise you, you're going to see worse before it gets better. You can mark my words. And when it does, I'll be able to look and say, you see what I said, it's going to happen. And I'm not the only one. A lot of other people will be able to say, we told you so. And you know what? It won't matter. Because politicians, people in the DEA, this is irrelevant to them. They have a mark to make. They have points to score. I don't know what they're trying to do, but they're trying to continue their agenda, whatever it may be. And it's going to get worse, and it's sad. I'm going to continue to try to get my care through a doctor the right way, and I hope that I will have a doctor. I hope it won't come to the point where there are no more doctors who can treat my ailment, because the things that don't work are the only ones that they're allowed to use. That's it with this. That's all I wanted to say. I wanted to describe what happened, and I wanted to show that the concerns that we are expressing are valid, and these things are coming true. And if anybody cares about the fact that millions of people suffer from chronic pain, and basically their only relief is on trial right now, and it seems that the only approach is not even trying to be informed. The only approach is just, let's get rid of it. And those people are just casualties. Sorry. This is what's happening. Any references or links that I can find that it might be relevant, I'll put into the description. Thank you for listening, and please share this with people who care. Thanks.